Thank you for joining us. Just wanted to let you all know that we are recording this webinar, so it will be available later and available to share. First off, just want to go over a couple housekeeping items. There is a Q&A option. So if you have questions, we highly encourage that you put them in the chat. We will actually be hopefully reviewing questions as they come through and answering them throughout the presentation. So you don't need to wait till the end of the presentation. We highly encourage you to put your questions and drop them in there as we go through the presentation today. So I'm Sarah Benatar. I am the president for the National Association of Hispanic County Officials, NAHCo. We are very excited to launch our webinar program here today with Bea Thayer. We're excited. We'll be having these once a month going forward. So please keep an email or a lookout in your emails for more information on these webinars as we start to schedule them, and we'll be inviting you going forward. If you don't get our emails, please just go ahead and email me. My email is sbenatar@coconino.az.gov, and we will make sure to add you to our list. So today we have a really exciting presentation today from a program that is out of Yavapai County in Arizona. And Bea Thayer is an amazing individual. I've had the pleasure of knowing her for, gosh, almost a decade, if not longer. She has done some amazing work in Arizona around behavioral health, and really in this new role has changed the way counties here in Arizona are actually addressing behavioral health, mental health, and the criminal justice system. So I'm just going to read her bio and then we'll get started. So Bea is a systems advocate supporting enhanced collaborations among multidisciplinary teams, and enjoys the opportunity to work as the Director of Behavioral Health Services for Yavapai County Sheriff's Office, as well as the Executive Director of the Yavapai Justice and Mental Health Coalition. Bea works to develop and implement strategies that lead to the long-term and sustainable involvement of community institutions, organizations, and individuals within the intersections of justice and behavioral health, with the goal of addressing partnership and system change. Bea's career has given her the opportunity to create partnerships and collaborations with diverse communities, professions, and agencies throughout Arizona to affect policy and change on both the micro and macro levels. And just really want to point out there, actually, NAHCo highlighted Bea and the work that she's doing in Yavapai County in one of their features on behavioral health. And so the model that she's going to be talking about today hasn't just become a model in Arizona, but it really has become a national model. So it's great information. I'm very excited to welcome Bea here today. So with that, I'll turn it over to Bea.
You're so kind. Thank you, Sarah. It's funny, I live in the same county as Sarah. Arizona has really, really large counties. There's 15 counties. Coconino is the second largest in the country, which is where Sarah's our elected treasurer at. And then Yavapai County, just below it, is, it's the size geographically of New Jersey, with about 250,000 people. So there's lots of spread out spaces, and there's mountain ranges. There's not continuous public transportation. It's quite interesting. We have a couple tribes. We have 12 law enforcement agencies here, 5 dispatch agencies, of course, the county sheriff, and then they're spread out all over the place, and they run the jail. So I just wanted to say that's Sarah and we do go back. I am going to share my screen before I get much further, and then go to here. Okay, that look good, Sarah? I can see it. Does that look okay? Okay. So as Sarah said, I'm with the Yavapai County Sheriff's Office, and as the Director of Behavioral Health Services, that includes the program, overseeing the program in the jail, and also overseeing the Justice and Mental Health Coalition. I've been working with Yavapai County for 8 to 9 years, and for Yavapai County for about 5 years. I was working with our Medicaid behavioral health plan that covered Northern Arizona. So it covered about 6 counties, and I was the criminal justice liaison and working to support processes and develop communication and plans and go through the glitches between behavioral health, mental health, substance use, and the justice system, because they do not speak the same language. I mean, one word could mean 16 different things, even within the justice system, like just within courts. There's like a bunch of different departments in there as well. So, I mean, you guys can all imagine you're within the counties. And so you even know just the different departments underneath each of your own county might not have the same language all the time as they go along. So I got the privilege to work with multiple counties and help Yavapai County begin their collaborative and their model and their jail reentry coordination program. So I'm going to kind of go through the why that we're focusing on the intersections of behavioral health and criminal justice, and go through a little bit on how the coalition created their goals, and then what the jail reentry coordination program does, and what some of the results are that we're seeing. So this is a way of tying together the behavioral health, social determinants of health, public health with the criminal justice system, and how those perpetuate crime or reduce adverse childhood experiences. So on the community conditions and social, economic, environmental determinants of health, those include employment, housing, education, exposure to environmental risks, healthy food, poverty, racism, other forms of oppression and empowerment. The physical and mental health outcomes, those can include chronic diseases like cardiovascular diseases, diabetes, infectious diseases such as AIDS or hepatitis, developmental issues, stress, anxiety, trauma, preterm birth, infant mortality. Behaviors can include substance use, substance abuse, theft, violence, as well as eating well and healthy and getting exercise. And then criminal justice involvement and criminal justice policies include involvement in a system, as well as policies that govern all aspects of the criminal justice system, including school discipline, the school to prison pipeline, policing, pretrial, prosecution, defense, adjudication, incarceration, release, and reentry. So just some statistics that are not going to surprise anybody, but you know, people who are not housed there's a cycle with folks who are not housed and into the justice system. There's already a set of ordinances and laws that make homelessness a crime, right? So where you're sleeping or camping inside of city limits, asking for money can be looking like trespassing. It can cycle around through the justice system. And then, of course, we know that people who are experiencing homelessness, quite a few of them are also experiencing some of these other behavioral health concerns, such as mental illness and substance addiction. And many times these are unmet behavioral health needs. Unemployment and behavioral health, they also have a correlation with each other as well. People who are not working, substance use can increase. We've seen that. We saw that a lot with COVID, didn't we? There was this whole talk about alcohol sales kind of going off the charts during that time. There is a evidence-based survey or research called the ACEs study that's pretty popular. And it demonstrates 10 adverse experiences that someone might experience before they're 18 years old, and how those experiences directly impact their whole life and what happens throughout their life. So it impacts, the more of these adverse childhood experiences that a person has can impact their education, their social, emotional, their physical health, up to the part of early death. So the list on the left are the 10 questions that are part of the childhood experience, the ACEs experience. So to be able to incorporate those into people who become involved in the justice system, either as victims and or as defendants, people who are struggling through them, that we know that childhood abuse or neglect raises the chance of juvenile arrest by 59%. And that approximately 90% of juvenile detainees reported having at least one traumatic event. 75% reported having exposed to severe victimization. We know that the vast majority of women who are incarcerated come from a traumatic past, whether that's emotional and or physical and or sexual abuse. And compared to the general population youth, our juvenile justice involved youth have roughly 3 times more of those adverse childhood experiences than the general population. Once in jail, it's really, it can become really difficult for a person with mental illness to become stabilized, to get the help that they need. We all have heard the term that, you know, the jails have become the mental health hospitals of the country, which they're not. They're not. It's not a therapeutic setting. It's not treatment. There's great programs that we've seen throughout the country in incarcerated settings, trying to support people who are there. But to think that it's a hospital, it really isn't. Folks with mental illness stay in jail longer than the general population. They're at risk of victimization when they're there. And what happens is that during a mental health crisis, out in the community, when people call 911 to say, hey, there's this person, Bea, and it looks like there's something going on, maybe she's talking to voices, or hey, I'm calling my adult son, hasn't taken his medications in a long time and he's really angry. It's more often that people are likely to encounter police than actually get medical help, which then turns into the cycle of the justice system.
I have a quick question for you. You just brought up a good point about medication. Now, I'm a foster parent, right? And I had a child live with me who, like, his IQ is probably off the charts. But when he wasn't on the right medication, he went straight from straight A's to D's, F's, and was very rude and disruptive in class. And then there was these tendencies of violence, or I don't want to say violence, aggression, right? And you just made a point about children not getting the right medication. How many of these kids, and I don't know if I know you may have to do research and go back and get statistics, but in your opinion, of these juveniles who get arrested, who are called to the house, because this child now lives with his mom, and his mom called me, I'm about to call the cops. I'm like, wait, let me go over there. Let's try to talk about this and see what his needs are. He's on the right medication now. But how many of these children are getting arrested, which in your opinion, that need proper medication, but it starts a cycle of them being in the juvenile system?
So the statistics that I have to share from here on out is on the adult system and not on the juvenile system. But Jenny, my main medical provider here at the adult detention center is also the medical provider over at our juvenile detention center. So I will definitely ask her those questions. But when I worked for our Medicaid health plan, in working with the different counties in their juvenile system as well. It was oftentimes the kids that would come into the juvenile system were already involved with a behavioral health provider, but it could have been not fully involved, right? And so, and one of the first things that's done is to try to get that connection with behavioral health and medical as soon as possible, because there could be so many things going on with that child
that we don't know. Yeah, because for me, it's a matter of intervention versus, let's say this child, my child was 14, and let's say he started getting into juvenile system at 15. Does this create a life career instead of going a career path where he goes back into society, gets a job and whatnot, a career of him being in the system, and that's a way of life, that becomes a way of life at a young age, right?
Right. And I mean, your juvenile systems are also all different, but the ones that I've been really involved in, they're focusing really hard that this isn't going to be necessarily a punitive thing that's happening. This is a intervention piece that's happening. This is our time of being like, hey, what do we need to do to get the families together? What do we need to do to get, this, to provide tools in the house, tools to the child, to hopefully deflect them out of future involvement. Yeah.
Thank you. Does anyone else have questions on the panel, the audience, before we move forward? Okay, thank you, Bea.
Yeah. So I will later on in the presentation explain to you how we get these statistics here at Yavapai County Detention Center, but just to show the why for the individuals that have been booked in to our detention center who went through a screening with one of our inmate service coordinators. We know that about 53% of the people have disclosed moderate to high risk in mental illness. And we're at about 48% moderate to high risk of substance use. And of course, those ACE risks, that high number is 4 out of the 10. And that's almost half of our population as well. So it kind of backs up a lot of these statistics that, people coming in to us on a misdemeanor or lower level felony side are also bringing some other of those public health and social determinants of health and behavioral health issues with them. Here's other risk factors that do affect recidivism and coming back to jail. So a third of our population disclosed that they were not employed. Quarter of our folks disclose that they do not have safe housing, and that one's huge because when we look at our recidivism statistics, that's one of our highest folks coming back are people that don't have safe housing. We do ask about transportation because right now our facility is really far out. I told you how rural we were. It's our jail, you have to go 15 miles to get to one town or 3 miles to get to another freeway. And then look at that primary care number as well, because we know that a lot of these individuals in what you and I would usually just call our PCP for probably end up at the emergency department. So some of the barriers when people do come into the incarcerated setting, whether prison or jail, to getting back on track is when you're in jail for a while and you're incarcerated for a while, most likely your employer has not kept your employment open. You haven't been able to pay your rent, or your family is like, I'm done, right? We've been going through this for a long time. So there's a lot of coordination that needs to occur in order to support people there. Stable housing, education, all of those issues come into play. We all know that there's questions on applications for employment and housing that ask if you have a felony in your background and what that could mean for trying to get you back on track. This is an old statistic, but it just goes to show that people who are incarcerated have a higher rate of a serious mental illness than the general population. And then that's the same for substance use disorders and for co-occurring, which is substance use and serious mental illness disorders, that the folks the folks in our jails are struggling with a lot of issues that haven't necessarily been met, which can, of course, trigger the recidivism and the cycling. So the Yavapai County Sheriff's Office kind of stuck their neck out a few years ago to say that they would love to take the lead on trying to figure this out. Like, they've talking to the folks in the jail. Why are you here? Why are you still here? If we had, shoplifted that amount or done that trespassing, we would have been out a long time ago. What's going on? And Sheriff Rhodes has a way of describing the jail kind of as a lighthouse, because it's a means of being able to see what's happening throughout the county on all of these different systems players. We're able to know personalities about each of those 12 law enforcement agencies by the folks that they bring in. We know what's going on with probation. We can understand that there's a housing crisis. We know what is happening in the different levels of the courts, what the prosecution and the attorneys, what their mind focuses on, what's happening with our behavioral health providers. Where's the glitch in getting people connected to behavioral health? Where's the glitch in getting people connected to housing and to other services as well? So the Yavapai County Sheriff's Office looked at two great toolkits. One of them comes from NAHCo, and one of them comes from the Stepping Up Initiative, which is also in partnership with NAHCo. And it's kind of at a leader, definitely a county leader level of looking at this issue, the intersection of behavioral health and criminal justice, and providing a framework and some steps and some conversation pieces around what your county, what your community can do, and how can you start having these conversations. It's always, both of them start out about leadership and stakeholders and understanding your baseline data. Do you have a way to track the data? And do you have a way to prioritize policy and funding as well? So we utilized that. At this point, Yavapai County actually had gone back to the state legislature, so that our states are responsible for funding the Department of Corrections and our prison systems, not for funding the counties and the county helping supporting the county jails. So the tagline was, hey, why don't we try to stop the flow of going to the prison system by identifying people at their earliest moments possible in their journey on the criminal justice system, and identifying what needs that they might have and how do we connect them to those needs. And so the Arizona State Legislature back in 2018 gave us our first appropriation to begin this Reach Out pilot program, and created a statute that said that our county jails or our county sheriff's offices can begin a jail reentry coordination program in collaboration with a coalition. And so I came down to help start with the coalition and pull all of our stakeholders together: adult, juvenile, behavioral health, law enforcement, social services, the courts, probation, everybody, to try to come together and look at this as a whole. A couple decades ago, Sam Seguin's Center created the sequential intercept model. And over the last few years, it's finally really taken off. And what it is, it looks at 6 intercepts in a linear way, even though we all know that this isn't necessarily a linear situation for folks. But it's looking at it in a linear way where people with unmet behavioral health needs might come into contact with the justice system. And what can we do to deflect, divert, identify, connect, support somebody at that moment? So Intercept 0 actually starts with prevention. What do we have even before law enforcement comes on board? What do we have for crisis lines and our community behavioral health providers? Intercept 1 is if law enforcement's there, can they identify people who are having a behavioral health crisis? And then what do they do? Is there a way to not take them into jail? Can they deflect them? Can they pull in some of those crisis teams? 2 is when somebody does come into jail, how do we identify somebody before their even first court appearance? And what can we do with that? And how do we get that information to the judges? 3 is talking about while you're in jail or while you're in courts, what does that piece look like to support an individual and to work with the community providers? 4 is what is the plan for you coming out? And of course, 5 is then working with the community. So the coalition came together and we came up with 4 main goals. We have improved cross-system collaboration to reduce involvement in the justice system by people with behavioral health disorders. Things that we do for under that goal is to create actual processes for multiple disciplines and stakeholders, pulling folks together. What does it mean when probation needs to make a referral? What does it mean when we want to connect with somebody for medically assisted treatment who's in the jail? We're looking at, some data about probationers who have a petition to enact, so kind of one of their timeouts. Why are all these people coming back to jail? What were they supposed to do to begin with? What are some of the other things that could support our system, like peer support programming, vocational and employment needs? What happens after hours? We're very rural. It's not like we have things open past 8 o'clock at night over here. We have one goal dedicated to children, youth, and families, and to increase behavioral health access for them. So again, we're working on procedures between behavioral health and the juvenile system. The families that are also involved with the adult probation system and the juvenile system, how can they speak together and work together and support themselves instead of adding additional burdens on because they're working in silos? We would like to increase the way parents who are incarcerated to be able to join in on their children's behavioral health team meetings or refer them to the team meetings. In Arizona, our civil commitment process is called Title 36, but it's that court-ordered evaluation when somebody's a danger to self or others, or acutely disabled and not able to take care of themselves through because of their mental illness disorder. In Arizona, it is the responsibility of the counties that this is that there are providers to do this, but it's a really hard system, right? I mean, it's a really bad moment in people's lives. It's adversarial. It's pretty difficult, and some glitches along the way. So we have a work group that supports this entire piece, and a lot of these individuals who wind up in the civil commitment process do so through law enforcement. So law enforcement actually starts this whole entire process when they come across somebody in the community who is in an acute crisis and not willing to accept help. And so sometimes it kind of goes in and out between the criminal justice system and the civil process. And we actually are getting some legislation passed right now on the state level to support voluntary evaluation, which would be fantastic and help get people more into the to services. And then we are also always looking at the bigger picture and trying to support policy and legislations and what's going on around the state and what's going on around our region and our nationally that we could affect us, or what can we do like right now to kind of support some knowledge and understanding throughout the state. And a lot of what we understand in the coalition that needs to be done is also because of what we see in the jail and working on our jail reentry program as well. So basically, our thought process is wherever you come into contact, can this be a no wrong door? How are we doing with any questions out there?
I'm writing down a list of questions for you.
Okay.
I mean, this is
And
so
take it-
informative. I'm like, okay, I'm gonna, like, everything you're providing is just so, you have the word motivating there, right? Because it's a story of hope rather than, you know, I was in my state capitol yesterday and we had different speakers with the California Hispanic Chambers of Commerce, and we had this one state legislator who spoke to us. And when I went there, I'm an undercover. Nobody knew I'm in government politics, but not because I want to ask some tough questions on the state level. But you get talking. We got to just put these people in jail. We got to put these people in jail. And this gentleman forgot who his audience was. He's talking to an audience of Latinos, Hispanics, right, who are youth. Because of all these things that you're talking about, right, and more, we have higher jail rates, right? But what are we, in the conversations I had throughout the day, even into the night, was about the prevention mode and what are we doing to bring long-term equity, because it was a business economic summit. So we talked about equity, but what you're talking about here at the same time with these programs and which I think is a beautiful thing with your sheriff's departments providing and working with the departments, because a lot of times the sheriff's department, because it's an elected office, there's this disconnect, right, with your local the other elected officials, counties, cities, and whatnot. But how important it is to build relationship.
Yes.
To provide long-term equity, because when you provide programs and you're saying there's no wrong door, you're helping the success of these young people on a long-term process where they're not going to be in the jail system at 24, 25, 30. Their kids are not going to have that absent parent and fall into that generational cycle, right?
Or we're getting them when they're 74, 75, 85, and their mental illness is now clashing up with dementia.
See, does that happen, Bea?
Oh, it's big.
Oh, really?
It is our newest, hottest topic, as the generation, as our generations age, dementia and cognitive disorders are coming, and they're looking and they're mirroring like mental illness. And so then how do you pull that apart? And Jenny and I know Sarah knows this too because of her family and her husband and where they're all at. Like, you follow the money, right? So who's the payer source? Well, you've got a payer source for mental illness, but that's not the same payer source that you have for long-term care for your dementia. And that can end up being, well, no, like one will say it's the other, one will say it's the other. And how do you pull it apart? And where does this person go? You can't civilly commit a person, even if they're danger to themselves because of dementia. So what do you do there? Yeah, it keeps on. That's one of our biggest ones, but I'll keep on going and then we can circle back. Okay. So, back to the prevention, right, and intervention, is to look at elements of a strong pre-arrest deflection. Let's not even try to get the people, if it's our first responders who are responding, what do they need as tools in their toolbox? And so there's a couple great training that we have regularly in Yavapai County, and that's available everywhere around the country. One is mental health first aid, and they do a mental health first aid for for first responders. It's an 8-hour class. It's like taking a first aid CPR class where you don't have to become an expert on heart attacks, but you can understand that this person has something occurring right now. How do I kind of identify it, and how do I know to get that person to the next level of care? And then crisis intervention training. That comes from the Memphis model. It's a 40-hour training for law enforcement and first responders. They understand, like a psychiatrist comes in and talks about all the things that's happening in the brain. And then it's this great collaboration with your community providers as they'll come in and facilitate different workshops about what substance use is. Why did this person need Narcan more than once and they keep going back and they're using again? What is medically assisted treatment? What is trauma? What does, bipolar look like or schizophrenia. What does that look like? Autism, people living with autism, that one can look like it can display itself in, for law enforcement, that somebody's not listening to the rules, right? So how do you work with folks who are experiencing these behaviors? And then there's a whole role playing at the end for law enforcement as well. Then on that, intercept 2, about when folks come into jail. So our reach out program that the sheriff's office has started here, and that is getting modeled around our state for jail reentry coordination, means to have people employed in the jail setting, because folks get booked in throughout the day, and it is a very quick and fluid population. You could be here 2 hours, 2 days, 2 weeks, 2 months. The vast majority of people in your local detention centers, your jails, are there pre-sentence, pre-trial. And so to try to rely heavily on your system partners to identify folks who are in the jail and to make those plans before they get out, they can just slip through the cracks, and all of a sudden they bonded out, they went to a hearing, a judge said, okay, you can go. Or you got folks who are in here where the judge says, oh, Bea, I'm really worried about you, and I'm worried about you being back out on the street, and you don't have a house, and I could tell you're not on your meds. So I'm going to just put this crazy bond on you, because then I know you're going to be safe in jail. And then, as we know, that kind of deteriorates. So everybody who gets booked into our Yavapai Detention Center has the opportunity to meet with a inmate services and release coordinator. And they do a screening. We have 10 questions related to substance use, 10 questions related to mental health. We do ask the ACEs questions. We ask a lot of social determinants of health questions, the housing, employment, that blue graph that I showed you before. Have you been involved with behavioral health? Where do you plan on living when you get out? How are you going to get somewhere when you get out? A post-screening report is generated, and that goes to the initial appearance judge. So now the initial appearance judge, they don't have all these answers. They have this other form that says, hey, Bea, glad you met with a release coordinator. It shows that you're at high risk for mental illness, but that you previously had been enrolled with Spectrum Healthcare and you're willing to get there again, and they can help do that coordination for you. And you know, if it's a low-level crime, we want the people out, right? So can we get them out without paying a bond and try to get them into somebody else's hands? If people stick around longer, then we start calling in the behavioral health providers and saying, hey, can you do an assessment and a treatment plan on this person? Can we get this person released early to treatment? Or, hey, there's something really huge happening. We have a restoration to competency program in our jail. So we have folks who are really acute, and we don't want that door to ever open without having coordination of care involved. So that's what our first initial conversation with folks coming into the jail are, and then a ton of planning with our partners afterwards. So the data that we publish, we have this great relationship with Northern Arizona University Center for Health Equity Research. And they are so wonderful and kind to us, and they take all of our data and they do all the wonderful things, and they can tell me so many different pieces along the way about the population that comes in, what's happening when we connect with them, what happens, who's coming back. And for this, the data that they had, it was 2 years of people who got booked in. And then we waited at least 6 months from the last person to get released. So that gives them at least 6 more months of getting into trouble. So some people had 2.5 years to get into trouble, or 6 months to get into trouble if they were going to come back. So of this 2-year cohort, over 4,000 were referred to treatment. 2,000 were connected to treatment, but connected could be a warm handoff. And then these 839 individuals that were diverted to treatment, those were people that we can actually count that we got out of jail early. We know that because of what we did, they got out early. Some of the folks who are on the petition to enact from probation, we can count how many days they got out early, because Bea would be sentenced to 45 days, but early release to treatment. I got out of 2 weeks. I can count those saved days. But a lot of these individuals, like, we know that we submitted an order to the court to say, we have this entire release plan of these folks coming out. And the middle line between housing and treatment, it's supposed to say transportation in there to tell you. But this graph basically is showing you that the higher risks that the folks have between mental health, ACEs, and substance use, that's the percentage of the people that we're really working. So we're working with the people that have the absolute highest risks. And so, of course, the folks with the highest risks do come back and recidivate at a higher level. They've got all of those issues that we've talked about, like that I was describing at the beginning, that they need to contend with. It takes a lot with the higher acuity that you have, the higher substance use that you have. So our overall recidivism rate for everybody who came in, whether they were screened, risked, or not, is over 17%. But I do, and then of course this is why we give people time to recidivate, right? Because the longer that you're out, the longer you have a chance to get into trouble. But those individuals that we were able to say that we actually got you out early and into a secure treatment plan, they had the lowest recidivism rate of 15.5%, even of those individuals who weren't at risk at all, and the whole general population as well. So that to me was extremely exciting, but it did include COVID when we weren't taking misdemeanant. So I don't know what's going to look like on the next one. So just for a quick glance inside of our jail, in order to get all of this going on, we have the director of behavioral health services, myself, a program manager, and then those other special coordinators and instructional specialists. And we have something really exciting occurring in our county, in that we have been in the process of building a new detention facility. So we'll have two, because remember how I explained how big our county was? We don't, and there's a mountain range that goes in between. So the main area, Prescott Valley, that's the county seat that has the main population. That is not where the detention facility is. And so our short-term folks will be booked into over on the Prescott side. It's going to be a smaller jail. That'll give us room over on the other side to kind of do some more programming. But during that, we have built a connection release reentry center. And so that little building that's kind of off to the right is our reentry center. And part of that is going to be that inpatient civil commitment space for our community provider that has that contract. But the other space closest to the jail is where individuals will be able to come out of the jail and then meet with service providers that are right there, ready to also speak with them and get that connection going. And just also sit down, plug in your phones, check your emails. What do you need in order for your next step? Or they can call back later and say, I told you I didn't need anything, but I have no idea when my next court date is. Just one more slide, I think, that I have. It's from 2018, so it's kind of old, but that statement that I made about the Department of Corrections and the county jail and the state is responsible for the Department of Corrections. But the Department of Corrections releases less than 20,000, around 20,000 people here a year in Arizona. And our our county jails release almost $250,000, which is why we're trying hard for the states and the counties to work together in order to change policy so that we could stop that flow and we could do this reentry planning at the level and the spot where we want to be. And then there's my information for more questions, but that is the end of my slideshow.
Before I turn questions, I have a list of questions, but I want to give our audience an opportunity, but you ended with something that just been flowing through my mind the whole time. And again, it's about the relationship. And kudos to you and your team and the sheriff's office to really recognize the importance of mental health and working and collaborating with other county organizations or nonprofits or whatnot. I know that with my county, you know, a few years ago, we started implementing whenever a sheriff would go out to call for a homeless person or whatnot, and we have what's called the care team.
Mm-hmm.
Consists of like a mental health professional and all the, or, you know, if it's like, if they're, you know, closing an encampment and there's a trailer that's been known to have prostitution or, you know, drugs going on there, they bring the whole team out, because what was happening is our sheriffs are not really completely able to do their job if they're dealing with mental health issues or dealing with, you know, a homeless person who needs help mentally, right? So that's something we're trying to do, and I see it's something that your county is committed to doing with the rehabilitation center. I'm curious, in building this rehabilitation center, and you said right between the rehabilitation center and in between the jail, when they come out of the jail, they go to this, like, I don't know if it's a holding
Reentry. It's more of a reentry. Like they're not going to, stay there.
Who, or in terms of funding, who are you partnering in terms of funding? And are you partnering with nonprofits? Are you partnering with other county organizations to go to, I guess, step 1A and then on to step 1B to the center itself?
So we've been partnering with our behavioral health providers, our social service, our housing, emergency housing providers, to connect with these individuals prior to getting out or right when they get out. But a lot of the connections then are made in the parking lot, or by the time that they do get over to the other side of the mountain, like it's too late, the doors are closed, or they've found distractions along the way. So the space inside is going to be kind of just an open collaborative spaces, so that there's no vendors, there's no RFPs, that only these two providers are going to come and do behavioral health applications, only this one's going to come and talk about housing options. And we're working together to try to figure out that flow. The health department has actually taken on, in collaboration with us, to kind of manage that. So the people in there, the community navigators that'll be stationed and working in there, those coordinators, will be health employees, which will be kind of nice for somebody coming out of jail, that it's not like another sheriff employee, that it's a health employee. And they're using, the health department is using their marijuana tax money. So we legalized marijuana. There was some very strict requirements to where those funds could be spent. And one of them was jail reentry coordination. So it was perfect. And then they're also using part of their opioid abatement funding as well, in collaboration with our state appropriation money to fund that. The actual Reentry Connection Center was built in when part of the funding from the county. However, we're hoping that if we receive our next portion of appropriation dollars, that we'd be able to help offset some of those funds that are coming. A couple of our other counties have received large chunks. One received 5 million, one received 4 million, so that they can actually use that on capital costs to build their center. In our current facility, We are going to do some remodeling and try to make this a little reentry center here as well. And we'll be using the Attorney General's opioid abatement funds for those.
I'm going to talk to my supervisor about this. I really like this model. Before I go on, I always have questions and they'll never run out, and I can always ask Bea at a later time, but I want to turn it to the audience and ask anyone who's participating if they have any questions or comments that you would like to make. And you can just raise your hand too, or you can type it in the Q&A. Okay, so Sarah, do you have any questions before?
You actually have a hand raised.
Oh, here we go.
So Commissioner Garcia from there he is.
There you go, Supervisor Garcia. Please ask.
Hey there, Adrian Garcia from Harris County, Texas, which is the city of Houston. And just thank you for your presentation. I apologize I got on late, but I was enjoying catching the last parts of it. And I'll just say, you know, again, kudos to you, to the sheriff's office. As a former sheriff of this county, I absolutely understand the value of contemporary mental health care. On any given day, a third of our population, and we have averaged since my days as sheriff, I'm county commissioner now, but when I came in as sheriff in 2009, we had 12,000 inmates in our custody. A third were on serious psychotropic medications. And I'm just so proud of our current sheriff, who has continued to move very strategic initiatives on mental health, on reentry, and it's just obviously the right thing to do. But in Texas, as you probably well know, we rank damn near last in mental health care spending per capita. And so this is why I wanted to listen to this, because as NAHCo has put me on the National Commission of Mental Health, and so I will continue to lift your work up, Bea, and those of others. And Sarah, thank you for helping to make this come together. This is just a very, very worthwhile discussion. So thank you all.
Thank you, Commissioner. I think Harris County has gotten some kudos for your mobile crisis law enforcement collaboration as well.
Absolutely.
Yeah.
Thank you.
Thank you, Commissioner Garcia.
Thank you.
Anyone else from the audience? We have about 5 minutes left before we close the end of our session. Sarah, do you have any questions?
I will turn it to you, Jenny, because I know you have a lot of questions, and I'm so familiar. Full disclosure, my husband is in behavioral health, and so I'm very familiar with this work, and I really want to let the group ask their questions, but I do want to just throw out there, it's had bipartisan support in Arizona, yes, and that's really been key. Huge bipartisan support. I think yesterday there was a bill that it's Pima and Yavapai, but the sheriffs will be involved in to even further expand the ability for jails to provide these kinds of services. And so, and you may know that a little better, but essentially it's definitely been bipartisan support here, which has been really impactful. Yeah.
I was going to say, I wish that I, of course, Sheriff Rhodes, it could just roll off his tongue how many millions of dollars that our legislature has devoted to us and the other counties to get this going. But it's like criminal justice reform without scaring too many people on one side that everybody's just going to get let out. But it is an absolute reform, and it touches everybody on their heartstrings as they go along the way. There was one other piece that has been really beneficial, is that we developed this cross-system recidivism tracking database. And thanks to where Sarah's husband works. He works for an institute that was gracious enough to help fund it and help do a study on how to expand it. So right now we have a $13 million appropriation bill waiting to be signed by the governor that would create 5 counties to get $2 million a year on an ongoing basis to do jail reentry coordination, including ours. Sorry about that. And $3 million to actually take that database and get it built on a cloud system statewide, so all of the other counties can have something very similar that everybody's kind of doing apples to apples. But part of that cross-system piece is that our dispatch has access to a piece of it. All the dispatchers here have access to a piece of it to be able to input if somebody's been deflected, where they got deflected to. So then if law enforcement calls later and says, I got Bea here, and they can look up and say, oh, you know what? She went to the crisis stabilization unit by this other law enforcement agency last week. And then also our behavioral health providers have privileges to see their members and give us post-release data updates as well. Okay, with that, go for it, Jenny. Sorry.
Great. So I'm going to ask one more question, and something that you hit to me being a woman, and I've worked in my nonprofit portion of my career, worked with women, at-risk women, not youth, but women. And I volunteered at a homeless women's shelter once when it was a shelter for women who were pregnant, but who had touched with the criminal justice system. And a lot of these women, the courts put them on probation. They get in jail time because basically they were in abusive relationships, they were coerced to sell drugs or whatnot. And when you spoke about women incarceration, that reminded me of the work that I used to do. In comparison to men, do you know what the for your county, what the percentage of women who are incarcerated? Do you feel like it's rising? Is it stagnant or is it decreasing?
No, it's rising. It's usually our jail, we're small, so we have an average population of about 550. I think our women average population might be between like 120, 140, 150. But I do feel it rising. And yeah, I think that there's a lot of coercion going on. We have the opportunity, we received a DEMA grant. And so we're going to be working with ASU's sex trafficking experts and putting together a screening for us in the jail as well to help try to screen and identify people who are being trafficked.
Thank you for that. I was on
Hard to connect.
Yeah, I was on a Human Rights Commission for a while, and my focus was sex trafficking and whatnot. And that's just kind of something that's kind of hidden and quiet. We know, but we don't know too much about it. So it's very good that you guys are setting that pace for other people to follow. Before we close, I want to ask if there's any more questions. Great. And I know there was a question about the recording. I'm going to send the recording to Sarah. She's going to send it out to everybody. We'll put a link to it as well. And for those who attended, for those who did not attend. And if you have further questions, please ask Sarah. And Bea, before I turn to you for closing remarks, I just want to say something. Again, this is about long-term equity, right? When we intervene and prevent work, that in the long run, we're all, county officials and working with the county. The bottom line, it has to do with economic development at the same time for me, because the less people are in jail and with these different programs, or even if they're in jail and they learn life skills, job skills, they in turn come back, they get jobs and they become sustainable financially. And that helps our economy in the long run. That, yes, we need more housing, but then you have more people who are going to build houses, or, we need these things. I would rather build more apartments, more housing, more houses than build more jails. And I think that's a question we need to ask ourselves when we think about these things and mental health, and what are we doing to create that long-term sustainability. Bea, I'm going to turn to you for final remarks, and then Sarah, I would invite you to close it out.
Well, I could just back you up on that equity piece and access. It's all, you know, access to the education, to the healthcare, housing is healthcare, just access across the board, because accessible services does not look the same for different populations and different backgrounds. But I'm preaching to the choir on that one, I'm sure, for everybody who's on here. So I will thank you very much, Sarah, for inviting me. And any other questions that you guys might want? We just got this fabulous Yavapai collaborative report done by some outside evaluators or outside consultants. And I don't know if I sent it to you, Sarah, but if you want to forward that along, if anybody had any other questions, it's pretty cool.
Thank you so much, Bea. And I'll make sure when we send out the recording that we'll also include that attachment as well. And Jenny, I want to thank you so much for doing an awesome job as our moderator. Those who may not know Jenny Chamberlain is the Chief of Staff for Supervisor James Gore in Sonoma County. And she is also on our planning team here at NAHCo. So really appreciate that. And then I want to give a quick shout out to Mercedes Sanchez. She is with Commissioner Garcia's office. She has helped so much with behind the scenes. So thank you, Mercedes. And thank you, Commissioner Garcia, for lending her to us as well. So again, thank you all. We'll be sending the information, the recording out shortly. And then we'll also have a link up on our website. And again, Bea, thank you so much. This was just very informative and really appreciate the time. And thank you so much for what you're doing here in our state.
Well, thanks for inviting us.
Thanks.
Bye.